Chronic diseases, they're growing at an alarming rate. The cost is astronomical, makes up 84% of all healthcare spending, and employers, they've tried different wellness programs, but sometimes they don't take off. At Sodexo, they're going in a new direction, a 3-year pilot program, and here to tell us about it, Nebeyou, Abebe, and John Cardone. Good morning, guys.
Good morning.
Good morning.
I want to tell me about this. How serious of a problem is chronic disease in the United States right now?
Chronic disease is a major problem in the United States. According to the CDC, the Centers for Disease Control and Prevention, 117 million Americans have one or more chronic diseases like obesity or cardiovascular disease or diabetes. And so Sodexo and the YMCA have joined forces to really curb the chronic disease epidemic in the United States.
Yeah, no, that makes sense. But what are the implications? What are the implications, I guess, for our economy and for our employers?
Sure. Well, for the economy, currently 18% of our nation's GDP is being spent on healthcare, and 75% of that is attributed to chronic diseases. And that 18% is expected to rise sharply over the next 20 years to over 30%. So there's definitely something that needs to be done. For employers, their healthcare costs are also rising, and they're doing their part in investing in workplace wellness programs to reduce their healthcare spend and also to provide health and wellness programs to their employees to improve workforce productivity and to just help them maintain a high quality of life. But they've struggled in really getting their employees to engage.
Yeah, I wanted to ask you about that, and it's that engagement, because like you said, many businesses, they want to do something. These workplace wellness programs, they haven't always worked, though. Why is that?
Well, I think it comes down to the traditional model. I think what typically happens is the majority of the spend is offering some type of membership to whether it's a YMCA or a local fitness. And we know that the majority of the population just isn't in that. They don't have the time, nor it's a very intimidating factor to go to a gym or a YMCA. So I think what we're looking at is that how do we really meet people where they are? It really comes down to personalized, evidence-based programs that are really specifically targeted to them versus just giving them $10 off or working with a discount and saying, now go do this on your own. Yeah. So it's really that old adage, it's a village to raise a child, and this partnership has really brought all the best aspects of all the worksite wellness programs, and we're really delivering it, and I think you're going to see that the results that we're seeing are remarkable.
Yeah, we've got about a minute left, but can you break this down just a little bit more? What's the difference about your pilot wellness program, and so I guess what are the results you're seeing so far?
Sure. So current workplace wellness programs are very fragmented in the way that they deliver the programs and solutions, the way that they engage the employees in the programming. And what makes our program unique is that we've developed a coordinated support system that takes the best practices for engaging workers, which also includes evidence-based programs like the YMCA's diabetes prevention program, et cetera. And we provide access and the adequate levels of support to the employees, whether that's through a Sodexo registered dietitian or a YMCA health coach at the workplace and in the community. So it's that long-term support that employees will be receiving under the Communities for Health initiative.
Fantastic. A website with more information about health and wellness programs in our area. I know you've got some of that information. What's that website?
You can go to sodexoinsights.com to review a case study on the Communities for Health program. Right. That is a featured article in our 2016 Workplace Trends Report. Fantastic.
Nebeyou and John, thanks for your time this morning. We appreciate it.
All right. Thanks. Have a great day.
You betcha. You too. Mary, over to you.